Hello everyone, my name is Diana, and for this presentation I will be discussing the community of Black women in the United States with a particular focus on maternal health disparities. So this presentation follows the Macro Practice Conceptual Framework by identifying the community, available data, discussing community access and resources, and exploring the social problem and developing a working hypothesis for macro level intervention. So, maternal health is an important social justice issue because every woman deserves access to safe, equitable, and high quality healthcare before, during, and after pregnancies. Unfortunately, Black women continue to experience significant disparities in maternal health outcomes despite advances in medical care. These disparities are influenced by multiple factors, including systemic racism, unequal access to quality of healthcare, socioeconomic inequalities, and public policy. As a future social worker, it is our responsibility to understand these challenges and advocate for policies and services that promote equity and improve health outcomes. So the community that I selected was Black women of childbearing ages living through the United States. While this is a national population, maternal health disparities affect Black women regardless of education, outcome, geographic location. Research consistently showed that Black women experience higher rates of pregnancy-related complication and maternal mortality than women of other racial and ethnic groups. According to Netting 2023, understanding a community requires examining its physical, social, and political dimensions. So, the physical dimensions include the neighborhoods, hospitals, prenatal clinics, community health centers, transportation systems, and housing conditions where Black women live and receive services. Access to quality health care varies significantly depending on where individuals live. Some communities have excellent hospitals and maternal care programs, while others experience shortage in obstetrics providers, limited transportation, and inadequate health care resources. Many Black women live in communities affected by environmental stressors, food insecurities, limited access and healthy foods, and reduced opportunities to preventive health care. These factors influence pregnancy outcomes and overall health. So the social dimension focuses on relationship, cultures, and the support system. Many Black women rely on strong family relationships, faith communities, neighborhood organizations, doulas, support groups, and community-based organizations during pregnancy and childbirth. The social supports often help women navigate difficult healthcare systems while providing emotional encouragement through pregnancy. The culture within the community emphasizes resilient faith, family, mutual support, and advocacy. Despite facing significant barriers, Black women have built strong networks that promote education, empowerment, and collective actions to improve maternal health. However, social factors such as discrimination, chronic stress, financial hardship, and implicit bias within healthcare settings can negatively affect both physical and emotional well being. The political dimension includes the laws, policies, finding decisions, and governmental systems that influence maternal health services. Federal and state government determines medical eligibility, maternal health funding, access to postpartum care, and investment in community health programs. Public policies also influence insurance coverage, productive health services, workforce diversity, and effort to reduce racial disparities in healthcare. Social workers play a very important role in advocating for policies that increase access to prenatal care, improve maternal health services, and reduce racial inequalities. According to NETI 2023, communities perform several important functions. One function is production, distribution, and consumption, which refers to providing essential resources such as healthcare, employment, housing, and food. Another function is socialization, where families, schools, churches, and community organizations help shape beliefs, values, and behaviors related to health well being. Communities also provide social control through laws, professional standards, healthcare regulations that protect public safety and ensure quality care. Finally, communities offer mutual support, allowing individuals to connect with others who have and share similar experiences, providing emotional, and practical assistance. Although these issues exist across the country, many disparities are particularly noticeable in underserved urban and rural communities where access to healthcare providers are very limited. For this presentation, I am focusing on the United States as a whole while recognizing that state policies and local resources can significantly influence maternal health outcomes. So, understanding the data helps social workers identify community needs and advocate for meaningful changes. According to the Center of Disease Control and Prevention, Black women are approximately 3 times more likely to die from pregnancies related causes than white women. Many of these deaths are considered preventable through timely access to quality health care, early interventions, and equitable treatment. Research also show that Black women experience higher rates in several maternity morbidity, including complications such as hypertension, hemorrhage, and cardiovascular disease during pregnancy and childbirth. These disparities cannot be explained by income or education alone. Studies have found that Black women with higher education and higher income still experience worse mental health outcomes, while white women with similar socioeconomic backgrounds. This suggests that structural racism, discrimination, and implicit bias within healthcare system play a significant role. Another important issue involves access to prenatal and postpartum care. When women living in medically underserved communities often experience delays in receiving appointments, limited access to specialist transportation challenges, and inadequate insurance coverages. Mental health is another growing concern. Pregnancy and childbirth can increase the risk of anxiety, depression, and trauma, particularly among women who've experienced discrimination or inadequate medical care. Access to responsive mental health services remain limited in many communities. The COVID-19 pandemic also highlighted existing inequalities by increasing barriers to health care access and disproportionately affecting communities of color. So the data clearly demonstrates that maternal health disparities represent not only a public health issue but also a social issue requiring coordinated action across healthcare, public policy, and community organization. Some of the primary sources used for the disparity include the Center of Control Disease, the National Institution of Health, the Department of Health and Human Services, peer-reviewed maternal health research, and netting 2023. So now that I have described the community that I reviewed the available data, I will discuss the strength, values, community access, leaderships, and policies that influence maternal health outcomes for Black women. One of the most valuable parts of a community assessments is hearing directly from people who work with or are part of the community. For this assignment, I spoke with a maternal health professional who works with pregnant women and families in the community. To maintain confidentiality, I will not identify this individual by name or place of employment. During our conversation, the individual shared that many Black women begin pregnancies already facing barriers such as limited access to quality health care, financial stress, transportation challenges, and difficulty finding providers who understand their concerns. They explained that while many women are proactive about their health, they sometimes feel their symptoms are not taken seriously by medical professionals. This can lead to delays in diagnosis and treatment, increasing the risk of pregnancy and complications. The individual also discussed the importance of trust between patients and providers. They explained that when women feel respected, listened to, and included in decisions about their care, they are more likely to attend prenatal appointments, ask questions, and follow treatment recommendations. Building trust relationships can improve both patient satisfaction and health outcomes. Another point that stood out to me was the importance of community support. The individual emphasized that families, churches, Douglas community organizations often help women manage the emotional and practical challenge of pregnancy. These support systems can reduce stress, increase access to resources, and encourage women to seek care early. As I reflected on this conversation, I realized that improving mental health, maternal health requires more than excellent medical care. It also requires addressing social determination in health, reducing system barriers, and creating healthcare environments where every woman feels respected and heard. So, the primary social problem affecting this community is maternal health disparities among Black women. Although the United States spend more on healthcare than many other countries, Black women continue to experience disproportionately high rates of maternal mortality and severe maternal complications. Researchers have shown that these disparities are influenced by multiple interacting factors rather than single cause. One contributing factor is unequal access to quality prenatal and postpartum care. Women living in underserved communities may have difficulty obtaining appointments, transportations, insurance coverage, or specialty care. Delays in receiving medical attention can increase their risk of serious pregnancy complications. Another major factor is structural racism and implicit bias within healthcare systems. Studies have found Black women are more likely to report feeling dismissed or ignored when expressing concerns about pain or other symptoms. These experiences can delay diagnosis and treatment in contributing to poor health outcomes. Social determination of health also play an important role. Housing stability, employment, income, education, neighborhood safety, transportation, nutrition, and access to mental health services all influence maternal health. Chronic stress associated with discrimination and economic hardship can negatively affect both maternal and infant health. The professional literature consistently recommends improving access to culturally responsive care, increasing workforce diversity, strengthening community partnerships, expanding postpartum services, and implementing policies that address inequity across the healthcare system. As social workers, we understand that these disparities are not simply individual problems. These reflect broader social, economic, and policy issues that require coordinated macro level interventions. One useful approach for understanding social problems is the framing process, which includes diagnostics framing and prognosis framing and motivating framing. The diagnosis frame identifies the causes of the problem. In this case, maternal health disparities results from multiple systematic factors, including unequal access to healthcare, structural racism, implicit bias, limited resources, and social determination of health. Rather than viewing poor maternal outcomes as individuals fail, failures, this perspective recognizes that border systems create barriers, place Black women in greater risk. The prognostic frame focuses on possible solutions. Improving maternal health requires collaboration among hospitals, public health agencies, policymakers, community organizations, and social workers. Potential solutions include expanding access to prenatal and postpartum care, increasing medical coverage, supporting community-based improving transportation, providing culturally responsive care, strengthening mental health services, and requiring implicit bias training for healthcare professionals. Community partnerships are also essential when hospitals work closely with community organizations. Women receive more coordinated services and experience fewer gaps in care. So, the motivational frame encourages actions. Social workers have an ethical responsibility to advocate for social justice and equitable access to healthcare. Through policy, advocacy, communi- community organizations, interdisciplinary collaboration, and public education, social workers can help reduce disparities and improve maternal health outcomes. Macro social work recognizes that lasting change occurs when communities, organizations, and policymakers can work together to improve the system rather than focusing solely on individuals. So, based on the information gathered and the research reviewed, my working hypothesis is if healthcare system, community organizations, policymakers, and social workers collaborate to reduce structural barriers, expand culturally responsive maternal health services, strengthen community resources, and improve access to prenatal and postpartum care, maternal health disparities among Black women will decrease, leading to healthier mothers, healthier infants, and stronger communities. In conclusion, this presentation examined the maternal health disparities affecting Black women through the Macro Practice Conceptual Framework. I described the community, reviewed current data, discussed community strength resources, explored the social problem, and developed a working hypothesis for addressing these disparities. One of the biggest lessons I've learned while completing this assignment is that maternal health is much more than a medical issue. It is also a social justice influenced by policy, economics, community resources, and systematic inequities. Social workers play an important role in advocating for equitable policies, building community partnerships, and connecting individuals with the resources they need. As a future social worker, we have a responsibility to promote human rights, reduce disparities, and advocate for systems that support healthier families and stronger communities. By working collaboratively with healthcare providers, community organizations, and policymakers, we can help create meaningful and lasting changes for Black women and their families. Thank you so much for listening to my presentation.